Okay, thank you very much, Shireen, and thanks everyone for coming. As Shireen said, my name is Josh Cullimore. I'm a GP in Brighton, and I'm vegan. I've been vegan for 10 years and vegetarian for 6 years before that. And I'm here to tell you about the benefits of a whole food plant-based diet. So to start with, I'm just going to tell you about a patient I saw last year. That's not him, and that's not me, maybe in a few years. But he came to see me because he was really fed up with all of the tablets he was taking for his diabetes, high blood pressure and high cholesterol. They were giving him lots of side effects such as diarrhea, tiredness, rashes, coughs, and he'd been on them a couple of years and he'd really just had enough. So I said, okay, let's talk about your lifestyle a bit. He assured me he had an excellent diet, which people always do, I find, but then went on to say that he eats lots of protein, lots of eggs and sausages and chicken, and that he does lots of exercise, and by that he meant he does some walking, but it never really got him out of breath. So I said, I would prefer to reduce the medication and gradually improve his lifestyle. But he was really adamant he just wanted to come off it altogether. So I said, okay, go away and read this. I don't know if anyone's read it. It's a really fantastic book explaining the benefits of a whole food plant-based diet and how to do it. So he went away, he committed to doing it. He was going to go to the gym 3 times a week as well. I was a little bit skeptical, but he came back 3 months later, and actually the first thing I saw was how much better he looked. He was beaming, he clearly lost some weight. And when we actually looked at his figures, his blood pressure on medication was actually a little bit high. And then 3 months later, it come down to 119/71. And then his cholesterol should be under 5, and it was just about okay with the statin. Off the statin and with a whole food plant-based diet and some exercise, it come to 3.5. And then his HbA1c, which is your measure of your diabetic glucose control, should be under 48. His, despite the metformin, was at 57. Off the metformin, it had plummeted to 26. He'd basically reversed his type 2 diabetes just purely with a plant-based diet. So that was us afterwards. We were both very, very happy about this. His wife was over the moon as well. She'd gone vegan, was really enjoying cooking new meals. They were convincing all their friends to go vegan, so he was basically doing my job for me. And interestingly, he had said that he'd started to read about the animal cruelty aspect of the animal agriculture industry as well, which he'd resisted until that point, and he was quite shocked. So just a bit about me. How did I get to this point? Actually, I've always been an animal lover. This was me in the late 80s, early 90s, which you can tell by the slightly interesting haircut. And that's my cat Woody. And even at that time, I really did question, why do I treat her like a member of the family, and yet we eat other animals? But I found that I didn't know any vegetarians, and I was really embarrassed to say I wanted to go vegetarian. Didn't even understand that veganism was a thing. So I secretly went vegetarian. I was scraping the meat off the plate into the bin when my mum wasn't looking, but she was looking and she caught me, and she accusingly asked me if I'd gone vegetarian, and I denied it immediately because I didn't want to be strange. But the signs were always there, because anyone of a similar age in the 80s would recognise Count Duckula. He was a vegan vampire duck who ate nothing but broccoli sandwiches, and he was my favourite. It was my favourite TV show, so the signs were there. But it was only later, when I went to university, to medical school, that I really started to think about this again. And it was doing medical ethics lectures, actually, we came across this idea of non-maleficence, or do no harm. It's one of the fundamental pillars of medical ethics. And I started to see the connection with this term ahimsa, a Sanskrit word from some Eastern philosophies, which is basically the same thing, do no harm, but for all sentient beings. And I just was struggling to see why I was being educated to be compassionate professionally, but then in my personal life, 3 times a day, I was continuing to contribute to great suffering. If anyone's read this book, you'll know how great it is, that it's a history of humankind. And the author has said that animals are the main victims of history, and the treatment of domesticated animals in industrial farms is perhaps the worst crime in history, which I would agree with. So this is when I had my Lisa Simpson-style vegetarian awakening when I was 21, and then when I actually read about and saw what happens on dairy farms and with eggs as well, I realised it was just as cruel, if not more so. So I couldn't put it off any longer, and I had to come out as a vegan. And I remember my mum being very disappointed. She thought it was very extreme. But things have changed a lot in 10 years, and fortunately she's now gone vegan herself in the last 6 months, and she's another great case study. She's lost lots of weight, her blood pressure's gone down, and she feels amazing, and she wishes she'd done it sooner, as we all do when we finally get there. And then to tie it back to the medicine. So I was becoming increasingly disillusioned with the medical system, really, in that the NHS is great at treating acute problems, but my first job was on a cardiology unit. Patients would have their life-saving bypass grafts, their angioplasties, but then straight afterwards they're given sausage and chips for lunch. There's no education, there's no trying to prevent these things happening in the future. So at that point I decided to look more at the root causes of illness. Our diets are so bad now that actually a bad diet is worse than drugs, alcohol and tobacco combined. So I went to Imperial College and did a master's in public health, and I was really shocked actually how many of the problems facing the world are due to animal agriculture. So for example, bird flu and swine flu are all due to animals being kept in unhygienic, cramped conditions. And then you've got bacteria like E. coli, Campylobacter, Salmonella. Actually, these bacteria are fatal. They do kill people every year. And then partly to compensate for that and to make the animals grow faster, they're pumped full of antibiotics. And in fact, half the world's antibiotics are used in animal agriculture as growth promoters. So the GPs get bashed for prescribing antibiotics unnecessarily, but actually this is a massive issue. And then obviously the environmental impacts are huge. It's estimated that a vegan diet uses only 1/3 of the energy, land and water that an omnivorous diet uses. And in terms of climate change, this is the vegan Nobel Prize nominee, Greta Thunberg, who started the climate strike movement. It's great that she's finally getting that back on the agenda, because we were told last year by the UN that we've got less than 12 years to stop climate change, and giving up meat and dairy and eggs is actually one of the biggest things we can do to stop that. And then a collaboration between an organisation called EAT and the Lancet, the biggest medical journal in the world, did this big study called the Planetary Health Diet, which was showing that a predominantly plant-based diet would actually save the world from climate change and all the other environmental stresses we face, and be the best thing for our health. So there's some examples there of what they suggest to eat, and you'll struggle to find any animal products there. This is the suggested plate. So half the plate is fruit and vegetables, then a large section of whole grains, then plant protein, unsaturated plant oils, and then only very small amounts of optional added sugars, dairy foods, and animal-sourced protein. Unfortunately, the majority of the world is not eating like this. There are some places in the world that do eat like this. These are the blue zones, and they're actually the areas in the world that have the longest life expectancy. And the things that they have in common are summarised in this Venn diagram. And you can see the things they all have in common include a plant-based diet and legumes. Legumes have such a powerful effect that they're given their own category. And all of the other dietary components are plant-based. So an example of one of those areas, a quinoa in Japan, this is what they eat. 67% is sweet potatoes. The dreaded carbs that people get so worried about nowadays, and then rice, legumes, vegetables, only 2% fish, meat and poultry. And this is an example of the macronutrient ratios that they eat in the blue zones. It's 65% carbs, and this is just worth pointing out that there's such an obsession now with low-carb dieting, high protein, the keto diet, Atkins, paleo. But there was this big study done in The Lancet last year, which showed that a low-carb diet actually shortens your life expectancy quite considerably, unless you do it in a vegan way, so-called eco-Atkins. So actually plant proteins and fats are good for you. So just looking at the advice from the British Dietetic Association, because sometimes people are still concerned that a vegan diet isn't actually nutritionally adequate, but they are very, very reassuring. They've said that plant-based diets which are rich in beans, nuts, seeds, fruit and vegetables, whole grains such as oats and rice, and cereal-based foods such as breads and pasta can provide all the nutrients needed for good health. This includes essential fats, protein, vitamins, minerals, and plenty of fibre too. Not only that, well-balanced plant-based diets that are also low in saturated fat can help you manage your weight and may reduce your risk of type 2 diabetes, cardiovascular disease, and some cancers. And this is a huge statement, because these are the issues which are crippling our NHS. These chronic diseases of lifestyle are what we are dying from now. In terms of weight, in the next 15 years, 3 out of 4 of us are going to be overweight or obese. Type 2 diabetes, by 2050, 1 in 3 of us will have type 2 diabetes. Cardiovascular disease is our #1 killer, and cancers, I'm sure you all know now, 1 in 2 of us will get cancer. So just to look at this in a bit more detail, this is the Adventist Health Study, one of the biggest cohort studies in the world, and it shows that on the left you've got your body mass index by category of diet, and there's a very clear gradient that the more animal products you eat, the higher your weight. In fact, the vegan group are the only ones with a normal BMI. And with type 2 diabetes, there's a very similar trend. Only 2.9% of vegans have type 2 diabetes versus 7.6% of a non-vegetarian diet. And people often say to me, well, how about fish and eggs and white meat? This is very clear that if you eat those, you're more likely to be obese and have type 2 diabetes. And in fact, again, another big study in the BMJ last year, a systematic review that showed that a vegan diet is the best for controlling and reversing type 2 diabetes. There are 2 kinds of cardiologists, vegans and those who haven't read the data. That's Dr. Kim Williams. He is a cardiologist who has read the data, so he is vegan. He was the president of the American College of Cardiology, and he can make that statement because the evidence, is so clear that there's at least a 32% reduced rate of dying from heart disease in people who don't eat meat, and it's estimated that 40,000 lives would be saved in this country alone if everyone did that. This is quite a striking picture. It's an angiogram, which was done by Caldwell Esselstyn, a physician in the States, which shows on the left, this is the main coronary artery, is quite blocked up there, you can see, with atheroma, sort of fatty-like cholesterol deposits in the artery. And then 32 months later, after having been put on a plant-based diet, you can see how much that artery has opened up. So this is quite revolutionary. I was always taught that once your arteries were furred up, that was it. But actually, we have the evidence now that you can actually reverse heart disease just by changing your diet. And then eggs, there's been controversy on and off over the years about whether they actually contribute to heart disease. And again, there was another study last week confirming, yes, actually it does increase your heart risk, about 8% risk of death per half an egg a day. They are full of cholesterol. And then fried food is obviously particularly bad, so fried chicken and fried fish increase your risk of death also. And this is just to show graphically the difference in cholesterol rates in between vegans and the average diet. And this line here, 150, it's estimated that if everyone had their cholesterol under that line, 90% of heart attacks would be eradicated. And you can see the average there for the vegan diet is 146. That's the total cholesterol. For your bad cholesterol, the LDL cholesterol, there's an even bigger difference there. And it also worth pointing out that there have been these so-called cholesterol deniers over the years who are trying to say that actually saturated fat and cholesterol don't lead to heart disease. In fact, there's absolutely no evidence for that. All of the major health bodies say this is an incredibly dangerous thing to be encouraging people to eat saturated fat and cholesterol. The head of Public Health England, British Heart Foundation, Heart UK, they're all adamant that cholesterol does cause heart disease. That's why we keep giving statins, because the evidence is so clear. And there is a suggestion actually that cholesterol deniers should be seen in the same way as climate change deniers. It's a small fringe group that are trying to make themselves out to the media like there's a debate when there really isn't one. This is looking at blood pressure. Again, the more animal products you eat, the higher your risk of high blood pressure. Vegans have got under half the risk. And it's all very well looking at graphs, but I find that I believe things when I see it with my own eyes. And this is a small moment for me to brag. This was my blood pressure during quite a stressful day at work, 89/59, which is actually probably the lowest blood pressure I've ever seen. So I was quite proud about that. It's working, clearly. And again, lots of studies showing diets high in meat, eggs and dairy could be as harmful to health as smoking. In fact, you're 4 times more likely to die from cancer or diabetes if you eat lots of animal products. And the biggest cancer organisation in the world, the World Cancer Research Fund, recognises that, and that's why they recommend a diet, which is what they have in the blue zones. It's a whole food, plant-based diet. They recommend a diet rich in whole grains, vegetables, fruits and beans. Limit consumption of fast foods, limit consumption of red and processed meat, and sugar and sweetened drinks. So if it is as bad as smoking, why don't we treat it in that way? Why have we not got warnings on meat? Why are we not putting a tax on meat? And again, there was a big study showing that would save hundreds of thousands of lives if we did that. And the answer is the industries are very powerful. And with cigarette smoking, we had the data for decades to tell us that it was killing people, how harmful smoking was. And nothing was done because of their propaganda, basically. So I'm confident we will get to this point, but how long, that's the question. And then on a similar note, you may have seen these adverts from Oatly, which I really like. They actually got sued in Sweden for these adverts by the dairy industry. But actually, you can't argue with the fact that cow's milk is designed for cows. They produce it for their young. It contains a compound called IGF-1, insulin-like growth factor, which causes rapid cell proliferation. And that is to turn a tiny calf into a giant cow. But if you have that compound in human adults, then actually rapid cell proliferation has been clearly linked to cancer. IGF-1 is clearly linked to cancer, particularly hormone-sensitive cancers like prostate cancer. And this study shows, yes, a vegan diet can reduce your risk of prostate cancer by 35%. So you may all be feeling quite smug now if you're vegan, but now is the time to point out there is a difference between a whole food plant-based diet and a junk food vegan diet. And in fact, you really need to try and minimise processed foods as much as possible, because the reason a plant-based diet has such a powerful effect is it's an anti-inflammatory diet. Those chronic diseases I've been talking about are all promoted by inflammation, and fruit, vegetables, whole grains, nuts, they reduce that, whereas fried food, sugar, refined grains, salt, they promote inflammation. And they all lead to diabetes, heart disease. They're toxic to the good bacteria in your bowels. There's lots of evidence now showing ultra-processed food is linked to cancer, and also mental health. Junk food definitely raises the risk of depression. There's some evidence now that depression is actually an inflammatory process in the brain. So avoid refined grains, so that's white bread, white pasta, rice. All the fiber's been taken out. There's very little nutritional value, and it will give you a big spike in your blood glucose and insulin. Try and limit salt to less than 6 grams a day, and you need to be careful with sort of vegan burgers, because often they have a lot of salt added to them. Tofurkey apparently are the worst. Fruit juice, I think a lot of people are aware now that fruit juice is not actually a health food. You've taken out all the good fibre, so you're just left with a very high calorie drink which has as much sugar as Coca-Cola. Try and avoid sweeteners if you can as well. There's evidence that sweeteners increase the risk of stroke and diabetes and dementia. So try and avoid. So what should you be eating? I really recommend this app, The Daily Dozen by Michael Greger again. It's free, and it's basically a checklist of all the things that you should be trying to incorporate into your diet every day. So first of all, beans, like the Blue Zone diet said, actually they have such a powerful effect, and it's one of the foods that have been highlighted to try and stop climate change. We need to be eating 5 times as many beans as we do at the moment. They're full of fibre, they're full of protein. Soya is a complete protein. Just worth pointing out now that there's a lot of worry about soya, particularly on men, because they have phytoestrogens, but actually there's no evidence at all that it causes feminizing effects in men. That is a complete myth, and there are lots of health benefits to soya as well. If they're so good, what is the main reason that people don't eat beans? I hear a lot that it gives people gas. And that's because if you're not used to eating them, you don't have the right bacteria to digest them. That will come eventually, and so I usually recommend people build up their bean consumption gradually. But if you do it very suddenly and you have lots of gas, I recommend these digestive enzymes are really effective at reducing that issue. Berries are some of the foods with the highest amount of antioxidants. You should be eating, at least a cup of these a day, ideally. If you're worried about the air miles and out of season and all the plastic, it's a good idea to get a giant bag in the freezer and add it to smoothies. Fruit, 3 portions a day. You'll notice that the recommendations are much higher than the 5 a day that we hear about. The 5 a day was picked just because it seemed more achievable for most people. It's not that it's actually the optimum thing for your health. Cruciferous vegetables, so kale, cauliflower, Brussels sprouts, again, very high in antioxidants. You do get more of the positive effects if you eat it raw. If that isn't your cup of tea, try and chop it up as much as you can 40 minutes before you eat it, before you cook it rather, because actually that means you get more of that positive antioxidants effect. Green veg, you should have a cup a day. Just a word of caution, if you take anticoagulants like warfarin, you should discuss that with your nurse, because it can affect the levels. But everyone else, eat as much green veg as you can. Another cup of other veg, particularly mushrooms and garlic and onions are very good for you. If you're less interested in health and vanity is more of an issue, then go for green veg and orange or yellow veg, as there's evidence that decreases wrinkles. It's recommended to have a tablespoon of flaxseed every day. That's partly because of the fibre, but also the omega-3s. And we've got some other examples here of foods that are high in omega-3. So walnuts, chia seeds are very good, also soya and rapeseed. Just to point out on the right here are some algae capsules. And they are the type of omega-3 that the body uses directly for the brain and the heart. Don't want to blind you with too much science, but just to clear this up, because often you hear doctors saying that the omega-3s from fish are better for you than from plant products, and this is just to explain that. So the ALA is the type of omega-3 that is in most plant foods, so the three on the left here. The algae capsules are the only ones, the only plant source of EPA and DHA. And that is the type of omega-3 you get in fish as well. And fish have it because they eat the algae. So you can just eat the ALA foods and then your body will convert it, but it's sometimes not the most efficient process and you have to eat quite a lot of those foods. So if you want to be really careful you're getting enough EPA and DHA, then I recommend taking one of these algae supplements of EPA and DHA. And if you're doing that, you're getting all the benefits of fish without all the toxins and mercury that come along with fish. Whole grains, again, massively important because people are so worried about carbs that there's been a big drop in whole grain consumption, and actually at least 90% of people aren't eating enough fibre. Whole grain bread is good for you, up to 3 pieces a day. Oats, very anti-inflammatory. Other grains like brown rice, quinoa, millet, couscous. You should be eating 3 portions a day. And just to point out that, again, this big study shows that a high fibre diet has a much lower risk of chronic disease and death. The vegans here will probably know this reaction. You probably get asked this a lot by people who are very confused about where a vegan can get their protein. I suggest asking them where they get their fibre, because that will probably throw them. But it's really not an issue. And in fact, animal protein, there's a lot of evidence that it's actually really bad for you. It raises your risk of early death. You don't need anywhere near as much protein as people generally eat. We eat over twice as much protein in the West that we should be eating. You need about 0.8 grams of protein per kilogram of body weight a day. So for the average man, that's about 56 grams, and for a woman, that's about 46 grams. And there were lots and lots of sources of plant protein: nuts, beans, grains, green leafy vegetables. If you're doing bodybuilding, you're trying to build muscle, then you do need to eat more, about 1.5 to 1.8 grams per kilogram. But for everyone else, it's really very easy. And tied to that idea is the idea that vegans are weak and have no energy. So I've created this slide, which is quite hard because there are so many plant-based athletes now, it's hard to know who to choose. These are sort of, highly professional, first-rate athletes. You've got Fiona Oakes, the marathon runner, Lewis Hamilton, Formula One driver, the tennis players, Venus Williams, Novak Djokovic. You've got the world's strongest man in the top right, Patrick Baboumian. You've got the boxer, David Hay, Anthony Moulali, the rugby player for Leeds Rhinos, Jermaine Defoe. Don't know the football team, he's a footballer. You've got Rich Roll, the ultra runner, and Nimai Delgado, the bodybuilder. So just some examples. If anyone ever asks you that, you can just show them this slide. The thing I hear most often is that people are concerned about women who are having periods and their iron consumption. And women tell me, oh, my doctor told me I'm anemic, so I need to start eating steaks again, which is very frustrating. And that is tied to the fact that, doctors get very little training in nutrition. I'm teaching at the medical school here, and until a few years ago, they only had 1 hour of teaching in nutrition in the 5-year programme. That's now gone up to 8 hours, which is better, but still obviously not good enough. So I just want to put this to rest. There's absolutely no reason to eat animal products for iron. In fact, the iron in animal products is heme iron, and there's a lot of evidence that it's that compound that is partly responsible for the increased rates of cancer, diabetes and heart disease in people who eat meat and dairy and eggs. So you don't actually want heme iron. Here are some examples of where you can get plant-based iron. Luckily, it's a lot of the same sources as where you get protein, so nuts, green leafy vegetables, pulses. It is absorbed less well than animal iron, so you do need to eat more of it. But there are things you can do to increase that absorption, such as having foods that are high in vitamin C, that helps you absorb iron up to 5-fold, and not having tea or coffee with your meals as well, because tea and coffee binds to the iron and stops you absorbing it. Another concern people have sometimes is that they're happy to be vegan themselves, but they worry about their children. And there have been, a couple of high-profile cases of people, of vegans having malnourished children. Actually, if you do some reading, there's absolutely no reason that would happen. In fact, childhood obesity is such a massive issue. We need children to be eating more fruit and veg. You're doing the best thing for them to give them a healthy vegan diet. And in fact, the British Dietetic Association has said that vegetarian and vegan diets are suitable for every stage of life as long as they are well planned. And then the equivalent in America has said that vegan diets are appropriate for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, older adulthood, and for athletes. If you do have young children, I do recommend obviously doing some reading. This is a really good guide from the First Steps Nutrition Trust, really comprehensive. If you read that, they'll be absolutely fine. And then another concern is about calcium and having weak bones and fractures. So the evidence again is clear. If you're eating at least 500 grams milligrams of calcium a day, then there is no increased risk of fractures in vegans. So the recommended daily allowance is 700 milligrams, but as long as you're getting 500 milligrams, you'll be fine. Green leafy vegetables and almonds are particularly good sources, whole food sources. If you're not eating enough of those, then I do recommend having fortified foods like plant milks. Be careful with the organic ones because they don't have added vitamins and minerals, but the non-organic ones have as much calcium as cow milk. And it is worth bearing in mind that they haven't eaten dairy in most of Asia for thousands of years, and they haven't had increased fracture rates. So something to be aware of, but not alarmed about. So in terms of, people ask me, should I be taking a supplement? I would say yes. B12 you need to be really careful about. You can have B12 in fortified foods, and if you go for that approach, you just need to be really careful that you're getting at least 3 micrograms a day in 2 separate meals. If you're doing that consistently, then that's fine, but if you want to be, careful, then I would just recommend taking a supplement, 10 micrograms a day or 2,000 micrograms a week. Iodine is something which is difficult to get on a vegan diet. You can get it from kelp, but there are unreliable amounts, and if that's not something you like eating, then I would recommend taking a supplement with 150 micrograms a day. Just be careful, like the Holland and Barrett vegan supplement doesn't have iodine, so just make it a point to check that when you're buying your supplement. And vitamin D, I recommend that absolutely everyone in this country takes vitamin D in the winter. We're all deficient. I recommend using this app if you're new to this and you're changing your diet. You basically just scan or input everything you've eaten in a day, and it totals up all of your macro and micronutrients, so you can easily see if there are any areas you need to address. So that's quite useful. The British Dietetic Association has a really good page all about plant-based diets, so I recommend looking at that. It's quite a brief summary. If you want to look into this in more detail, this is a really good book by a vegan dietitian in the States. He has a website as well called veganhealth.org. And then, of course, plant-based health professionals, run by Shireen Kassam here. So we've got a fantastic website, lots of resources, and we've got a conference coming up next month in Warrington, and that's open to the public, so you're very, very welcome to come to that. And then there's this VegMed International Plant-Based Conference. We've got some big speakers like Michael Greger, who else? Neil Bernard are coming to that. So I think it's nearly sold out, so do sign up if you're interested. I've got an Instagram page, Vegan Dr. Josh, so you're very welcome to follow me on that as well. So just to finalise really, actually some people find the idea of changing their diet is more terrifying than dying, but that often is the choice. It is the way we are leading our lives. It's our lifestyles that is making us sick. So we have that choice if we want to be Homer Simpson or Lisa Simpson. For your health, for the environment, for animals, go vegan. Thank you.